Hi, I'm Tom, and I work here at Silver Springs. Come on in. This is the Service Transformation Team, and with your help, we have transformed our service for the better. And what a journey we have had.
Good evening. The coronavirus is the biggest threat this country has faced for decades. From this evening, I must give the British people a very simple instruction. You must stay at home.
Cancer Services, through working with the Transformation Team, have been able to implement best time pathways, personalised care and stratified follow-ups. This enables swift diagnosis, early treatment plans, quality support, patient education and knowledge, all of which give the patient control during difficult times.
The integrated neighbourhood teams have produced a professionals neighbourhood directory to support health teams, community voluntary and social care teams and the primary care networks to work more closely together.
Hi, I'm Lee Crabtree, Directorate Manager for Outpatients. Recently, we have implemented our Outpatient Transformation Programme Board, enabling us to work together as a system to transform our end-to-end pathway through outpatients for our service users.
In the last 12 months, we've launched the 12 quality assurance standards that are reviewed monthly as part of the quality assurance rounds. In line with these, each month we put the spotlight on one standard, providing increased focus and education relating to this area across the Trust. 7 months in, these have been a huge success and we look forward to continuing to learn in the coming months.
This year, Frailty Board has overseen many transformational projects throughout our care homes, communities and hospital trust, ensuring an end-to-end pathway that is integrated with health and social care, with clear communication so we enable our residents to age well.
Prioritised under 3 themes underpinned by the national framework, palliative and end-of-life care transformation is expecting to see an increased use of personalised care and person-centred training, an increase in the use of electronic patient care systems, improved access to resources via a digital platform, and more public awareness of why having conversations about dying matter.
The Community Gateway Phase 2 Service Improvement Project is around the development and implementation of a new community urgent and non-urgent triage command centre model. Implementation is due to go live February 2022.
Hi, I'm Jonathan Peacock, the Divisional Director of Clinical Sports Services, and we recently introduced a Rheumatology Improvement Board aiming to establish new pathways for our rheumatology service to ensure that our patients are cared for in the right place.
Hello, my name's Anthony Edwards. I'm the Associate Divisional Director for Medicine and Urgent Care. Recently, within the Urgent Care Directorate, we've established a transformation board to look at how we can further improve the patient experience who require urgent care services. This transformation board is looking at areas, for example, the emergency department, the urgent treatment centre, and also same-day emergency care.
Hi, I'm Peter Grace. I'm the Associate Director for the Intermediate Tier Services. Since COVID, we have implemented a streaming service within our ED department. This helps to ensure our patients are seen by the correct urgent care service and the correct level of clinician in the quickest possible time, improving our patients' experience.
Our community teams have been working hard to transform services. Some examples include the Stamford Unit Medical Model, NWAS handover from scene, digital health streaming in ED. All are designed to make a difference to our patients, and there's too many to mention. Community teams have seen the same amount of patients, in some instances more, than before the pandemic, demonstrating their resilience and ability to adapt and rise to the challenge.
People have established multi-agency focus groups across SEND and cared for children to share ideas and initiatives across all agencies. We have also developed our local offer to provide families with user-friendly, accessible information and resources for all our SEND children, young people and families.
With the Ulysses Transformation Scheme, we're looking at how the system can automate information for us to improve efficiency and governance information, and how we can best support operational teams with governance oversight.
The service transformation project in radiology revolved around making the data available work harder. This allowed us to understand our capacity and demand for the service and begin to reshape the department to meet the future needs of the Trust.
Since the start of COVID, the domestic team have carried out enhanced cleaning and environmental decontamination in order to limit the transmission of COVID-19. The adoption of new technologies such as ultraviolet room sanitisers allows for the disinfection process to be done in minutes, and as such reduces any delays for bed occupancy.
Hello, I'm Tracy Campbell, the Deputy Director of Nursing. Within the Safer Care portfolio, we've developed some virtual assurance panels to review patient harms and an education event following these panels each month to rapidly share learning across the organisation.
Hello, my name's Melanie Pickering. I'm the Assistant Director of Integrated Governance. As a result of COVID, we've redesigned and developed a room into a virtual courtroom. This has supported clinical staff to attend virtual inquests, which have continued throughout the pandemic.
Hello, my name's Rob Conyers and I'm Head of Patient Experience. We've started a new project to use patient property boxes to help keep people's personal items safe. Items such as dentures, hearing aids and glasses can be kept in the boxes to help keep them in one place and to easily identify where a patient has these with them. This project aims to improve people's experience and make sure that items are not lost while someone is in hospital.
I'm Kevin Parker-Evans, Deputy Director of Nursing for Acute and Operational Services. The nursing and midwifery teams have been and continue to be on a transformational journey, supporting change and improvements for our staff and patients. A recent initiative has seen the implementation of a check-in and check-out huddle, supporting our nursing and midwifery teams at the start and the end of a shift.
It definitely has been a journey for all of us, but a global health pandemic was never going to stop Team Tameside and Glossop. Thanks to all those teams for their ongoing commitment to continually improve services for our patients and the transformations that have been achieved during unprecedented times. Thank you to all those teams who faced the additional pressures due to the impact of COVID, working alongside business as usual, including critical care, the theatre team, our medical teams and all the support services who have worked hard to keep our patients safe.